the major themes coming out of this conference has been the new diagnosis of HPV-related oropharynx cancer and the molecular pathway analysis of head and neck cancer now that we can dichotomize the tumor into HPV positive and HPV negative tumor states. I think we're beginning to see emerging signatures that will help us to define the biology of both the environmentally related cancers and the HPV-related cancers, and that we'll soon have real tools to define new therapies for patients with both of these diseases. I think the pathway analysis has really demonstrated that we have several important signaling pathways that are altered, and that the primary alterations in head and neck cancer, unlike, for example, GIST, where there are driver mutations, are the elimination of suppressor genes. Loss of suppressors are much harder to treat than driver mutations in, for example, tyrosine kinases. So we're seeing within the head and neck biology the appearance of overactivation of various signaling pathways as a result of the loss of tumor suppressors. And the important emerging pathways are the classical p53 pathway, which we know is highly mutated in head and neck cancer that's caused by environmentally related processes, the Notch pathway, which is a differentiation pathway, the PI3 kinase pathway, which is a mitogen activating pathway, and the RB P16 axis, where P16 is frequently mutated, and that suppressor gene is lost and allows RB to stimulate cell mitosis. So we see now an emerging picture of head and neck cancer that's being really elucidated in a very, very articulate fashion at this meeting, and I think this is going to signal a change in the way we really think of head and neck cancer over the next decade. Other important findings and themes here has been the focus on HPV, and I think the flagship discussion came from Dr. Gillison's reporting of the NHANES data, which simultaneously came out in JAMA, demonstrating that the prevalence of HPV 16 infection is high in the United States population. It's particularly high in males as opposed to females, and that this is really the first sign that it's an extremely prevalent infection. The incidence of observed positivity in the saliva suggests that there is almost 100% infection in the entire population when we get beyond the teenage years. I think this really urges us towards early vaccination of boys and girls, and I'd like to urge the oncologists to remind their patients that vaccination is preventative and will prevent cancers 30 years from now. I think it is important because it does tell us that a vast majority of people that have HPV infection, of course, will not get a cancer, but it also helps us to begin to define how to look at individuals and perhaps develop different ways of assessing risk. We, in our own group, had an abstract looking at antibody seropositivity in patients with HPV-related infection, and we believe that seropositive testing may actually allow us to identify individuals at risk in the future, as well as be predictive of responses to therapy. Other major themes here include a long discussion about the consequences of radiation therapy, managing side effects related to radiation, and the importance of looking to the future to prevent radiation-induced toxicity in patients, as well as acute toxicities of mucositis. So we're going to see over the next 4 or 5 years a number of efforts, I think, led hopefully by the Radiation Therapy Oncology Group and other cooperative groups to look at long-term consequences of treatment, particularly in the age of HPV, where we have many more patients surviving long periods of time.